Initial stabilization of the acute ST elevated MI. So here firstly there can be the supplemental oxygen. This is if the SaO2 is less than 90 degree or in case of dyspnea. Next there can also be addition of the aspirin. This is the 325 mg as well as the P2Y12 inhibitor. This can include the clopidogrel. Next there is also presence of the nitrates which are sublingual and presence of the beta blockers. Beta blockers is used unless hypertension as well as the bradycardia as well as CHF, that's chronic heart failure or the heart block. There can also be addition of the high dose of statins, and this includes such as the atorvastatin. This is about 80 mg. Next there is also presence of the anticoagulations. This includes the drug, it totally depends on the planned revascularization. Now we are going to look at the symptoms and how to exactly treat it. So in case of the persistent pain, or in case of the hypertension or the heart failure, so in such cases what is done is IV nitroglycerin is given, and it is not given in case of the hypotension as well as the right ventricular infarct, or in case of severe aortic stenosis. Next, in case of the persistent severe pain, in such cases the IV morphine is administered. Now in case of the unstable sinus bradycardia, in such cases IV atropine is administered, and in case of the pulmonary edema, in such cases the IV furosemide is administered. This is in pulmonary edema, and it is not if the patient is not given if the patient is hypotensive or hypovolemic. Next, these all lead to the reperfusion. This includes the percutaneous transluminal coronary angioplasty, also known as PTCA. This is done within the 90 minutes preferred, as well as the thrombolysis is done. This is if the PTCA is not available within the 120 minutes. This is done.